Good morning, I'm Mabel Zhang, and you're watching the World Healthcare Congress Interview Zone. And right now I have Dr. Ira Williams with me. He is the author of 3 books. His latest is Find the Black Box, the solution no one else is talking about. Now, Dr. Williams, in your book, you identify what's wrong with the American health system, and you provide your solution on how to fix it.
Well, I identify what has either been unrecognized or ignored in the last quarter century in the efforts to improve the quality of healthcare and patient safety. And in writing my last 2 books since 2010, this came out last year, I have come to visualize what a 21st century healthcare delivery system could and should look like.
Okay, first of all, let's start with what do you believe is one of the overriding problems of the system today?
There are basically 2 areas. One, there are 2 fundamentals. All medical care is local and states license doctors. Therefore, in our nation, in our system, states are responsible, each state, to create and maintain a functional healthcare delivery system. And no state governor or legislator, past or present, has ever had a clue how they failed to fulfill that responsibility. The other major problem is that we cannot talk about healthcare without using the word system, and yet it is devoid of any systematic characteristics. It is a non-system, and it was recognized to be a non-system in 2000 in Terror is Human, and 4 years later in Dr. McGlynn's RAND Corporation study. And they both recognized it's a non-system, but didn't follow through and say that may be the root cause of our problem, and it is.
Okay, so in your book you outline pretty clearly what you think needs to be done. Can you briefly explain that to me now?
I don't outline my plan for the 21st century because it's too big. I would need all day, 8 to 5, to lay out my plan. And things that I would offer would go far beyond anything anyone's ever imagined on how to coordinate the activities of the healthcare delivery system.
So coordination is one of your key
But
words.
I do in this book show it should be a 3-phase process.
Okay, what are those 3 phases?
Well, phase 1 is where are we now and how did we get here? Too many people would want to change a system no one can describe in detail. I predict there's not a presenter at this Congress who can describe in full detail their states, wherever they live, their state healthcare delivery system. I have identified 16 components that contribute to the South Carolina healthcare delivery system, and by looking at them closely, I have seen there's absolutely no systematic coordination between 2 or more of those components. They each one function as though they all speak a different language.
Okay.
And so until we can get a organizational structure at the state level, South Carolina has 68 hospitals and 65 surgery centers. So when one of them is doing something very positive, they don't have the means to have that flow throughout the system.
Yes, okay. So there isn't adequate communication between it's too fragmented.
Yeah.
So do you believe that there is a simple way to get that communication going?
Not simple.
Okay,
and
but
no
is that the key?
wand.
Is that the key? Getting people, different divisions speaking with one another?
You've got to get an entirely new structure. To give you a good example, I live in Greenville, South Carolina, the home of the North American headquarters for Michelin Tire Company. They have 9 different plants making tires, just in South Carolina. They have a few others throughout the Southeast. They could not exist as effectively as they do without an organizational structure flowing through all
Sure.
those plants.
Makes sense.
Well, we have 68 hospitals and 65 surgery centers, and we have no means of flowing anything throughout that system in South Carolina.
Isn't that what we're trying to build, though, with the Accountable Care Act?
All right, but no. The Accountable Care Act is how to pay for health care after the fact. Obamacare, Romney Care, Clinton Care, Medicare, Medicaid. I speak to the healthcare delivery system, and I believe they're as different as boys and girls, and I believe you must focus on them separately. In other words, if you had a perfect way to pay for healthcare, the delivery system would still be dysfunctional.
Why?
And I know how to change that because of no organizational structure, and because it's a state responsibility, because all medical care is local and states licensed doctors.
Okay.
And I'm the only one saying that, and I'm the only one focusing in also on surgery centers, because as an oral and maxillofacial surgeon, oral surgery created surgery centers decades ago. We were doing outpatient general anesthesia in the 40s and before, and doing it well.
Well, Dr. Williams, I think that in order for people to know more about what your solution to our problems here in the healthcare system need to be, they need to read this book.
My book is a tool to help people have a deeper understanding of the healthcare delivery system and the problems inherent in it. Our healthcare delivery system has evolved like a weed patch with no master gardener. I want to supply a master gardener.
Okay, we're going to have to leave it there.
Okay.
Thank you so much, Dr. Williams.
Thank you. It was a pleasure.
And I'm Mabel Jong. Thanks for watching.